Now to our COVID coverage today. It will be a few days before we find out how much the holiday weekend affected the case count here. Cases already going back up, although it's an increase in tests that might be the reason here. 141 new cases today, third day in a row now with more than 100 cases after several weeks where most days were under 100. 1,100 cases are now active, no new deaths for the second day in a row. Hospital bed availability is improving, as are the other reopening metrics that are still in yellow, according to our official documentation. And today we're also getting a look at the latest heat map of active cases. So here you go. Take a look at this. We want to show you the map from the height of the midsummer case spike. This is from late July. Remember, the darker the red, the higher the cases here. Incredibly high in southeast Nashville and in the downtown core. Well, here is a side-by-side now with this week's updated heat map. It shows you just how much active cases have dropped in the area. Pale pinks everywhere except for a small cluster in northwest Nashville. That area is home to several state prisons, including one of which saw a spike of 50 cases, as we reported earlier this week. So that map appears to show South Nashville and downtown, once hotspots for the virus, are doing much better today. News 4's Joshua Cole live for us today after speaking with an epidemiologist with the health department. That person saying there's been a lot of effort to get the virus under control in those specific areas, Joshua.
Hey there, yeah, that's exactly right. We're in South Nashville right now, and this is one of those areas that was hit especially hard by COVID-19. Now, this area also is home to a lot of our immigrant and refugee populations, as well as some lower income residents. Now, the health department says that they had to have special targeted campaigns like on social media to help get COVID-19 under control here.
We're cautiously optimistic that we're starting to have a steady decline in cases in those communities.
Epidemiologist Leslie Waller with Metro Health says, like the rest of the city, our areas hit hardest by COVID is seeing improvement.
A large part of that was social media outreach, using figureheads, everybody from community influencers to pastors.
The health department used targeted campaigns and other common languages to these areas like Spanish and Arabic. Health department officials even went into communities to offer more testing as well and encouraging mask use to slow the virus. The state and Nashville's health officials also began looking at active case numbers and the positivity rate with new guidelines that caused a drop in cases. Health officials say regardless of how numbers appear, efforts like the mask mandate and phases appear to be working.
I think we're getting there, and I think we're seeing the fruits of a lot of those orders, mandates, and efforts to really change that behavior.
Yeah, and so when I was talking with Leslie, she said it's also important to remember that when you look at these heat maps, it shows the current concentration of COVID-19. So right now, like you said, there was a lot of testing in our prisons up in the northwest side of town. That a lot of the concentration is being pulled up there right now at the moment. But she said overall, looking at the numbers and how things are going down, we are seeing a lot of good news here.